Welcome to HealthStack. HealthStack is an electronic medical record that is used to manage your health organization. In this video, I'll be walking through how to manage a patient in the ward using HealthStack. You would want to navigate at this side button, this sidebar to ward, and then clicking on inpatient shows you the list of patients that are currently in the ward. You can start managing patients from there, but I would like to go from my admissions list. Your admissions list gives you a list of patients that are waiting to be admitted. So this could be patients referred from clinic, referred from other facilities, or working patients. So in this example, I'll be using Kasim Maiwa. So to admit these patients, this drop-down gives you the billing mode of the patient. So what plan is the patient using? So the options are cash or family cover. That would indicate cash here. The ward the patient is being admitted to, ABC ward admission. In your the instructions is give fluids and monitor. In your facility, your beds could be labeled any way you like. It could be labeled 1 to 10, A to Z, or even using characters. In my facility, my beds are labeled 1 to 3, so I would want to admit this patient from bed 2. So I would also bill this patient for this service. So you bill, and then you can see the patient's name, the payment type, the date and time, the invoice, and the total amount. So I'll search for admission. You can see there is nothing coming up. This is because the patient is under a family cover payment type. That means this service, this admission service, is not covered by the family cover. So if I switch to cash and click on admission, you can see several admission services pop up. So I'll click on 24 hours admission. So to add services to your billing mode will be shown in a different video. So I want to add this and then complete. So I've billed this patient for this. So now I can admit this patient. So admit. You can see the patient's name is no longer here. So I would go to my inpatient list and you can see my patient here. So to attend to these patients, I'll click on it and this interface comes up. So teleconsultation means I want to have a video call with the patient. So clicking on it brings out this pop-up. I would then copy this link and share it to the patient. And when I'm ready, I'll join the meeting. So let's see how that looks like. So you can see the video call. Let me drag it up here. And also see so at the end you can leave the meeting and close. So you can also create documents for this patient. So you can create if you want to click the patient for asthma, adult asthma, you click adult asthma questionnaire and you can see pops up. So you can just fill in this information about the patient. Same goes for clinical notes. You can fill it in. Same goes for doctor's notes, lab results, medication lists, um, new patient consultation for this when you are meeting a new patient. The um, nursing notes, pediatric pulmonology form. There are various forms you can fill here. Actions have charts, radiology request, laboratory request, prescription request, or end and counter. Charts include your fluid intake and output charts, labor observation charts, continuation sheets, dialysis log sheets, pressure areas, temperature charts, vital signs charts. So in this patient, I was asked to monitor fluid. So fluid intake and output charts. The date is today. The fluid type is input. The route is intravenous. Fluid is normal saline. Volume is 500. Comments. Ah, so submit the chat. So you can see that whenever you create something for the patient, this is like the patient's folder. This box here is the patient's folder. So you can see the previous things that have been done to the patient. You can see I admitted the patients. You can see I billed the patient for the accommodation. You can see the patient was asked to be admitted. You can see the patient was discharged. So right now you can see that the latest thing I did was a fluid input and output chart right here. So this is seen as the patient's folder. So at the end of attending to a patient, there are several things you can do. So before that, I would like to look at this box here. So this gives you an overview of the patient. This is the patient's biodata, the patient's payment information. Account shows you how much the patient currently has. So this is what has been done. Here shows you specific instructions to the patient's allergies, comorbidities, disabilities. Then this also you can also see appointment history as like previous appointments. You can see drug intolerance, medications, past history, problem lists, tasks to do on this patient, and diagnosis history. So this gives you an overview of the patient and how to manage the patient. When you're done with that, you can end encounter. That is, you're done with this patient. You can choose to continue the management. You can choose to set up next appointments. You can choose to discharge the patient. You can choose to admit the patient to ward. You can choose to refer the patient, or it can be an unalive patient. So in this case, I would like to let me demonstrate how set next appointment is. So this is how it works. So you search for the patient is Kasim. Sorry, Kasim. You search for the employee that would be seeing the patient. The location is ABC Outpatient Clinic, and then on site, the date is this date. Appointment type is follow up. Appointment status is scheduled. The reason is follow up. So you can submit this. So after that, I would like to discharge this patient. So you can see, there's a mistake. You can see to discharge patient, patient stable. So can discharge. So discharge order sent successfully. You can see here we've also asked the patient to be discharged. So if you go to the ward and check on your discharge list, you see person is here and it's pending. So thank you very much for your time.